Hello everyone. Today we are going to discuss about a topic valvular disease. In this disease there are many kinds of valvular disease like mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, tricuspid stenosis, tricuspid regurgitation, pulmonary stenosis and regurgitation. It includes many all these things. And to f- uh, to understand about a valvular disease, we all we need to understand is what is regurgitation. So in stenosis, this is the normal valve. It looks like this. It opens properly. So in stenosis, the valve get attacked by some bacterial infection, some bacteria like streptococcus bacteria, or due to some fever like rheumatic fever, which is caused by mainly the immune deficiency. uh, Also streptococcus bacteria is also responsible for the rheumatic fever, and all those things the valves get uh, chewed up by some bacteria, or due to that reason it doesn't open properly. So because of that, the blood flow, what you know what the in mitral stenosis, the blood flow, the valve doesn't opens at wide as it should, and the blood flow from the left atrium to the left ventricle is partially restricted. So let me draw these things. So let us assume that, so the flow from the left atrium to left ventricle is restricted so that it doesn't flow properly. And that is decrease of blood flow from left atrium to left ventricle. In mitral valve regurgitation stenosis, or it includes the both mitral valve stenosis and mitral valve regurgitation. In this mitral valve stenosis or regurgitation, the main cause for this valve rupture or it get diseased because of rheumatic fever. Rheumatic fever is the main cause of this mitral valve disease. So, because of that, when when there will be restriction in the blood flow from left atrium to left ventricle, so the pressure in the left atrium will increase. The pressure will increase, the hydrostatic pressure that will increase in left atrium, and because of that, we know that left atrium is connected to our lungs. Lungs supply oxygenated blood from pulmonary veins to left atrium. So because of that, if there is increase in hydrostatic pressure, the flow the flow of blood from our lungs to our heart will be restricted. The flow of our blood will be restricted because of this increased pressure, and because of that we can see pulmonary edema in lungs, because in lungs the capillary because in lungs the blood vessels will get more pressure, and because of that it can burst out, or because of some reasons we can see pulmonary edema in mitral stenosis. And after that, thromboembolism can also be seen in mitral stenosis because of more dilation of left atrium. More dilation of left atrium, we can see thromboembolism, or left side heart failure can also be seen in this case. Now we will see the pathophysiology. The pathophysiology of mitral stenosis, I have wrote it in very simple form. At first, we can see that elevated left atrium to left ventricle diastolic gradient. Because of mitral stenosis, there will be less blood flow from left atrium to left ventricle, and because of that, the left atrium will get more hydrostatic pressure will be exerted in it wall, and it will get dilated. After that, the left atrium pressure will increase. At what I say, and because of that we can see the left heart failure. After that we can see after that we can see the pulmonary hypertension, secondary right heart changes. Yes, we can see the secondary right heart changes. You know why? Because the right ventricle, we will divide it in. So left atrium, right ventricle will send uh, all its blood to lungs, na? Right, to lungs. So if there is more pressure in left atrium, blood can't flow properly from lungs to left atrium, and because of that left ventricle will need more pressure to send blood to our lungs, and because of that the ventricular muscles will get thickened, that is hypertrophy, ventricular muscle hypertrophy can be seen. And if there is increase in muscle number, or you can say cardiac muscle, that is ventricular is thickened, we need more oxygen supply, but there is only a few amount of blood is getting oxygenated and it's sent back, and because of that we can see right heart failure too. And after that we can see left atrial enlargement. Yes, left atrial enlargement, because there will be more pressure. After that, atrial fibrillation and thrombus, risk of thromboembolism can be seen in this mitral stenosis condition. This is the whole pathophysiology of mitral stenosis.